Hello, this is Shonda Schaefer, and I am blessed and honored to be the CEO of Grace. And here is another edition of Grace Gabs. We are so thrilled. We have got some fantastic guests here today to talk a little bit about what's going on in our world in this whole COVID environment. And I see Judge Whitley just joined us. I'm so glad to see you, Judge. How are you?
Great, and I'm sorry that Vinny and everybody else is late because we were on another meeting and couldn't get off of it.
Well, I can't tell you how much I appreciate you fitting me into your schedule. I was just talking with Vinny and Matt here. We just got started, and of course, Judge Whitley needs no introduction, but we all know he is our county official here, and he has been one busy man. With him is Vinny, Taneja.
Taneja.
Thank you. Vinny, your title is Director of Department of Health, yes?
Yes, Director of Public Health, that is correct.
Public Health. Thank you so much. I probably should have prepared better for that. And of course, we have Matt Feryan, our local Grapevine Fire Department, and he is in charge of emergency management here in Grapevine. So thank you all so much for joining us. I'm telling you that first of all, Judge, you need to know our last Grace Gabs that you joined me on was one of our most visited sites. So people want to hear what you have to say, and I appreciate that. But I would love to start with you, Judge, and just have you kind of give us an overview. Where are we today? What's going on in our county?
Whoa, a lot is going on. I felt like I was fairly busy until I tried to track our public health director. I think Vinny said he's going from about 2 in the morning until about 10 at night. And that's on a slow day. We're all, especially our workers our hospital workers, our, first responders, our public health people are all just, running on gas, running on fumes. They have been just, working tremendous hours since about a year ago, since about March when all this started last year. And, we can't say enough good things about them and the job that they do. We have, initially we were all focused on let's get tests, let's get all this stuff done, let's be ready to go. Social distancing, masks, washing your hands, doing all of those types of things. Now we're in the vaccine phase of this deal. And, we're scurrying around doing whatever we can to try to find vaccines and then to get them in people's arms. And, we've got, and Vinny will probably go over some of these numbers too, but we've got probably 600,000 people who've registered at Tarrant County. A lot of the problems that we've got is that we don't have a good data system coordinated throughout the state. And so in the meantime, we've each gone in and filled that void with our own different types of software. And so, of the 600,000 that have been registered in Tarrant County, almost 180,000 of those are from other counties. And people are, basically, if you agree to be a mega hub, which Tarrant County is, you agree to take registrations from all over the state. Vinny's told me this morning, he said, we actually had somebody from Mexico call and register. And we said, yeah, you're not New Mexico, you're old Mexico, and we can't take you. But it's, people are registering all over. And what we're doing is every week, like today, or maybe late last night, Vinny got okay, here's what we're going to send you. And he may get it today. And Robert Early over at JPS was supposed to get $19.50 this week. He was told that last week. It came in on Wednesday. Vinny's allocation for this week came in, I believe, last Thursday. So we're just, the one thing that we've learned through COVID is don't brace yourself in any one position because you're going to have to move. And you got to be flexible and you've got to be willing to change. And that's just the order of the day. And that's the way we have to work. So, what I'd say is we're doing the best we can and we're staying as flexible as we can. And the goal is to get shots in the arms to everybody who wants it as quickly as we can and try to get back to normal my hope, and I'm an optimist, so my hope would be independence, celebrate Independence Day and independence from COVID-19 on July the 4th, but that's probably pretty aggressive.
I love that. Speaking of that, real quickly, where are we in terms of our shutdown, or not our shutdowns, but our modifications? If I remember correctly, it was a 15% over 7 days. And I know I get on those calls. I know we haven't had 7 consecutive days, but
we haven't been under it 7 consecutive days. Once you go over it, then it's supposed to close down all the bars and take everything back to 50% capacity. That's the governor's order. That is the governor's order. And then it doesn't open back up until you hit the 75 or the 7 consecutive days of under 15%, which we're at least moving back toward 15%, but we've not even gotten below that even for the first day. And doing that and staying below it for 15 consecutive days is liable to be pretty tough.
So just for clarity, we're talking about hospital capacity, because I think the conversation went into 15%. I wanted to just make sure that, it's hospital capacity consumed by COVID is what we're talking about.
And roughly, where are we about now?
I believe it's 18%. I'll have to look at the latest numbers, but we are heading in the right direction. Over the last 3 weeks, we've been starting to decline. At the peak of, I think the peak week was about week of January 8th, and we were at about 28%. And we're steadily coming down over the last 3 weeks or so.
Well, that's fantastic. And I know it's somewhat of an arbitrary number, but it does help put in perspective where we are and how close we're getting to Independence Day. So, Vinny, I know you guys, first of all, I got to tell you that I am so thoroughly impressed with Tarrant County's approach to this. And I've been watching some of the other counties, and it is not, I can't even imagine what you've had to go through to get it to this point. But all in all, with a few hiccups here and there, I am so impressed with the tenacity and the flexibility that our county has shown through this whole process. And that's a tribute to all 3 of you men and others that are working on it. But if you want to take just a minute and tell us kind of what you've got going on. I know we were talking about mega sites and things like that. What information do you want our Grace Gabs family to know about getting vaccinated and the role that public health is taking there?
Absolutely. So the first thing we want everybody to do is get signed up. And the website to do that is www.tarrantcounty.com/COVID shot. So it's tarrantcounty.com/COVID shot. And if you don't have access to a computer or have any challenges getting online and filling out a form, you can call our hotline at 817-248-6299. And there are people that can speak multiple languages. Typically, we have folks that can do English, Spanish, and Vietnamese. And if other languages are needed, they call in a translation service so we can help the folks on the phone get registered or answer any questions about the vaccine. And like the judge was saying, that we're doing this at mega sites across the county currently. We have a location in Hearst at the conference center, and it's all by appointment only, so it's very important to register. We have a location or 2 locations in Fort Worth at the Resource Connection at the Bob Bolin building, and then a partnership with City of Arlington. They've got it at the old Arlington Convention Center. Now it's called the Esports Stadium. All of us partners are working off of the county's wait list. So all of this is sort of flowing off that list. If you register there, you might get called to one of these locations, whichever one is closest to your house and whichever one's open where they have an appointment available. So it kind of varies by day. But what we're trying to do is get almost 7 days a week coverage. Right now we have 6 days a week covered so that people have some options to go to. And then the main issue remains, like the judge covered, that there's about only, limited capacity of vaccine coming in. The county as a whole has been getting about 27,000 a week, and that's split up between us and our hospital partners and City of Arlington. So it's been a little slow going, but if you look at, we started sort of in late December. Until now, we've already given close to 200,000 doses. The most recent update on our dashboard showed 160,000. That was like on Monday, but we know that data sort of lags because it's coming from DSHS. So almost 200,000 doses have been given. and almost 20,000 people have completed their entire series of 2 doses. Now, I know it sounds like a small number, but we just got started and the vaccine supply is very limited. And the final thing I'll say is it is still a medical service, so we do ask that people bring some sort of identification that they're the person that we're giving the vaccine to, but there is no requirement. I know there's always questions about undocumented folks and things like that. We're not worried about checking on that. The pandemic is affecting everybody the same. So if you're here in our community, we will take care of you. But we do want to see some kind of proof. If you say I'm Vinny and I need the shot, well, tell us, show us something that proves that you're Vinny, because we can't give a medical service to somebody and it be for somebody else.
Sure, that's awesome. And real quick, the prioritization, are you still working on that, or is this now kind of pulling from location and first come kind of deal? How are you working down that list?
So the current state
No
guidance,
first come, first serve. No, don't you ever utter those words out of your mouth.
You don't want people showing up on your front doorstep.
Anytime I hear walk-ups, I can say they have done screwed up, because you're going to have 40,000 people lining your building, and ain't none of them going to be happy, even if they had an appointment, because they're going to have to wait.
Fair enough. Fair enough.
Yeah.
Vinny, I'm sorry, but that.
No. Hey, these are serious things, and we got to have a little bit of humor in there. Otherwise, the day just goes crazy. So thank you for peppering that in. But yes, there is a prioritization, and it's what the state, expert committee on vaccine allocation and planning. So EVAP, they have sort of outlined what we should do as Texas all across. So there's only really 2 categories they've opened up. One is called 1A. That's where all the first responders and hospital workers and doctors and home health people, all the medical professionals, they're in that one category. And then something called 1B, that's where a lot of the general public is, but there's limitations. So either you're over 65 or you're under 65 with health conditions. So that's the 2 main categories that we're pulling people from. Once they register, based on the information provided, we categorize into those 2 buckets and we pull from there. After that, there's some other things that we apply, like, oh, are they critical worker, or do they live in a priority zip code, all those type of things. But that gets complicated. So the main thing to remember is that either you're in 1A if you're a healthcare worker, or you're in 1B if you're general public and have underlying conditions, or over 65.
And I want to stop for just a second and go back to the zip code preference, because we've heard a little bit about that on the news. And when we looked at that preference, we were giving preference to those zip codes where there had been a surge in the number of positive cases. Didn't have anything to do with anything else. And I'm not sure, and we were only allocating a small portion of our total vaccine allocation for the week. We weren't allocating all of it. And I don't know to what extent, are we still allocating a percentage to that each week, Vinny?
Yes, sir. It's a 0.25% allocation, and it just kind of sits on top of so it's still the same categories, 1A or 1B. You still have to be eligible. We're just allocating 25% of our effort to those 10 zip codes that had a high outbreak over the last 30 days. So that's where we are. And it's approved by the state. They actually sent us a directive that look at your hardest hit areas and start addressing those with a little bit more priority. So that's how we've done it.
That sounds completely reasonable to me. And so I guess the end statement on that is sign up, because you take it from there. So even if you don't fall in that 1A or 1B, you need to get on the list and then let you guys do your job of going down the list in priority order. Is that fair enough? Does that sound like a great statement?
Yes.
Yeah, all right.
Yes. Definitely.
All right. Well, I want to move. Yeah, awesome. Well, I want to move over to Matt real quickly. And you guys know Matt as our City of Grapevine Fire Department and Emergency Management. He has had a busy job as well. I get to be on a couple of calls with y'all on how it's working out here in Northeast Tarrant. So tell us what kind of our local folks are doing on this front.
Yeah, on the vaccine front, the city has been happy to partner with the 14 cities of Northeast Tarrant County to help run the Northeast Tarrant County vaccination site in Hearst. I've been involved since day one in operating that facility, and early on, the critical need and still remains staffing and coordinating the staffing. And specific to Grapevine, our fire department is providing sworn personnel to be vaccine administrators. Our police department is helping with traffic control at the site as well. And then there's a number of city staff that rotate through on a weekly basis to run various positions that are needed, just like the other cities of Northeast Tarrant County. The site can't run without people doing the jobs on the back end. And that's everything from greeting patients, from getting them into the system, checking them in, and then eventually giving them that vaccine. And so early on, no one of our cities could do what is going on right now in Hearst alone. And so it's been a very rewarding mission, especially being in emergency management, where we are all about collaboration, to see so many different entities come together and make that a successful site.
I love it. You know, guys, I feel real honored to have all three of you on today. And I'm just so proud to be a part of our community right now. I mean, we've got the best of the best in the worst of the worst times, but I also see some amazing silver linings. You see people stepping up and serving in ways that they've never had an opportunity to serve before. So I appreciate all of you. I will put on this video links to the sign up and as well as the phone number. So we'll make sure everybody has that information. And I can tell you, you know, from the sidelines out here at Grace in Grapevine, we think you're doing a great job. We stand ready to do whatever we can to help in the efforts. We're going to be working with THR to bring some mobile units out and start some vaccinations out here in our zip code when we're in line for it. And we'll make sure that we do that as best we can. So you just keep us in mind if there's anything we can do to help, and we will keep cheering you on from the sidelines. Vinny, I hope you get some sleep. Poor thing. I can't even imagine when your bag's under your eyes. I know I'd be if I was you. So
sleep is overrated, folks.
We'll let him sleep through 2022.
That's right.
Fair enough. And I'm gonna be seeing you on 4th of July, Judge. That's gonna be where my fingers are crossed. We're gonna be able to meet in person by the 4th of July. I like it.
I hope so.
Thank you guys so much. And to all of our listeners, thank you for joining us for another edition of Grace Gabs. And remember, please, please, please take care of yourself and each other. And we'll see you again soon. Take care.
Wear your masks.